Hello everybody, welcome back to Tuesday Tips with Back to Health. My name is Dr. Gleb Kartsev. Here's my student, Deborah. She is coming to us from Downstate University at her 4th affiliation, and today we're going to demonstrate certain scoliosis correction exercises that we suggest to our patients to perform at home, something that you can do by yourself and make sure you benefit from it. So today we're going to discuss the thoracic C-type scoliosis, which is often demonstrated as the outside seen as the dropped with the one of the sides of the shoulder different, depends on which side. So we're going to demonstrate left-sided thoracic scoliosis. So Deborah is going to be my model for the first exercise, and then we're going to switch. So exercise is going to be performed in front of the mirror. The idea of the exercise is the correctional posture exercise, also that involves neuromuscular re-educations. Basically, when the person being reteach how to maintain their body alignment. The left-sided thoracic scoliosis C-type, you're gonna often see the one of the sides drop. It's gonna be the right side drop shoulder of the shoulder. So meaning right shoulder is going to be lower when you're looking at the alignment versus left. It might be not as prominent as it's demonstrated by Deborah right now. It can be even a little bit. So yet it's still significant, especially over the course of the time when you're sitting a lot, when you're doing a lot of sitting job and anything. So the idea why you're using mirror, you're using mirror as a feedback. So we're trying to instruct the person with the scoliosis to level the shoulders. We're trying to bring the alignment. Especially when you're working with your kid or spouse, please look to them at them from the side. Make sure that it's going to the level side. So use clothing that would not be too bulky, so you can get the proper feedback. First you level out your shoulders, then you're making sure your posture is straight. Chin tuck if you have a little bit of a forward head posture. And now, with the holding this position, if it's comfortable, you can move on to the next progression, which is performing daily tasks. One of the simplest one, what we love to do every morning, drinking coffee. So we can use the cup. The idea here to perform the task without losing the alignment. So now, Deborah, please try to reach for the cup, drink from it without losing the shoulder. You might see this compensation. So naturally, because the body already adapted to the misalignment, she's going to be dropping. So here's the task. You have to guide them. You have to indicate your shoulder dropped. Guide them a little bit with your hands and make sure that they're going through the motion into the drinking position and back without losing the balance. That's the exercise. Try to repeat it as much as you can. I would suggest to do it as often as possible at the first beginning of the home exercise program. As you're getting better, you're going to be doing it less and less until it's going to become your automatic. This is also can be translated to any other task, as a teeth brushing. Same, you have to maintain the shoulder alignment, get into the position, perform the activity, and get out of the position without losing an alignment, or hair brushing, anything, or frequent reaching. For example, if somebody perform works that requires overhead activity, everything is done with the maintaining of the alignment. That will definitely guide all the muscle structures in the upper back and upper quadrants to maintain it and keep the proper postural alignment to stop progression of the scoliosis, especially crucial in the young kids. Right now, Deborah is going to demonstrate second exercise for the home exercise program for the left-sided thoracic scoliosis. I just want to emphasize that if you have the other side, right-sided T-spine scoliosis, thoracic spine scoliosis, you're going to do the mirror exercise, meaning you're going to symmetrically do everything for the opposite side.
Okay. So right now, you can lie down on your back. All right, bend your knees. You want them to be in a comfortable position, legs bent. You can separate them a little bit more. Okay, so first in this position, we want to make sure that the shoulders are aligned. So we would have the child or the adult correct themselves and shoulders back. Good. When that happens, sometimes under here goes up. So you want to encourage to go down right there, okay? Once you have this position, the child or the adult can put their hands right here. And what you want to encourage is breathing equally onto both sides. A lot of times what will happen is because of the spine abnormality, you might be breathing into one side more than the other. So what I'm going to ask you to do is breathe in and out. Good. Without losing this posture. And again, in and out. Good. Once it looks symmetrical and good, and you can ask the child or the adult if they feel it equally, you can have them lift their legs up and maintain this position, and then continue the breathing exercises. So breathe in. Good. They can hold this for 20 seconds, rest, and then do it again for about 4 minutes, making sure that their shoulders are nicely aligned, that their back is properly aligned. This you can perform every night, right before bed, or in the morning, right before they go have breakfast, go to school.
This exercise is, as the previous one, also oriented for neuromuscular reeducation. So try to plan your day where you can repeatedly do the exercise. And as I said on the beginning, it's crucial to do it as often as possible. Later on in the development, when you already develop a good postural control and good body awareness, you're not gonna need to do it as often as before. So in this case, we're not also looking for correction, we also looking for stopping the progression of the scoliosis that often happens around 12 and 13 years old for kids, and adults will also benefit it, even though we're not looking only for the maintenance but also flexibility. If you like the video, share with your friends, and thumbs up.